it's estimated that 25% of the global adult population is potentially affected by NAFLD, with the highest prevalence in the Middle East, as you can see on this slide, and South America, and the lowest in Africa. So around 20% of NAFLD patients have NASH, of which 1/4 have cirrhosis. So the problem with these figures and numbers is that the prevalence is rising. If we model the epidemic of NAFLD, it demonstrates exponential increase in burden of disease.
Of course, we all know there's a bidirectional relation of heart failure and liver disease. If you have congestive heart failure, you might also develop so-called cirrhosis cardiaque or pre-stages of that, congestive hepatopathy. And we also know actually that the CVD driven potentially by NAFLD or the mixed dyslipidemia may actually lead to reduced ejection fraction heart failure, so HFrEF. But the interesting thing here is that NAFLD is also associated with another form of heart failure, which is HFpEF, so heart failure with preserved ejection fraction. So not a weakened heart muscle, as you can see on the upper right, but really a stiff heart, so diastolic dysfunction.
And also, if you then specifically look into the number of platelets in NASH livers in different models, you see that the number of platelets is increased, the number of aggregates is also increased. And it's not just a question of number, the morphology of the platelets is different, the platelets are more activated and the functionality is altered. So there is clearly a link between at least NASH and platelets that are accumulating in those NASH livers. And if then these animals were put on a dual anti-platelet therapy, aspirin and clopidogrel in this case, you can clearly see that liver weight goes down and also that other parameters of liver damage, this is the NAFLD activity score, so a histological score of the liver damage and inflammation, also was substantially improved, not completely normalized, but substantially improved with the dual antiplatelet therapy. If patients have advanced liver disease that they are taken care of in specialized centers, that's for sure. But I think it's at least something that you could consider. It's not in the formal indications, but for me, having severe NASH, even if it's with or without advanced fibrosis, should become one of the comorbidities that could put forward the indication to bariatric surgery.